Welcome to the Power of Partnership podcast. I'm Riane Eisler, President of the Center for Partnership Systems. This podcast brings you voices from the partnership movement, people using partnership practices to build a world that values caring, nature, and shared prosperity. The Power of Partnership podcast is hosted by Cherry Jacobs Pruitt, a health policy and partnership scholar. And now on to today's POP podcast episode.
Welcome, everyone, to the Power of Partnership podcast. I'm so excited today to be interviewing Gwynne Guzzeau of the Helping Our Women organization on the power of partnership in creating healthy communities. Gwynne, on behalf of Riane Eisler and the entire Center for Partnership Systems team, I want to welcome you to the show.
Thanks so much, Sherry. It's a real pleasure and honor to be here today.
Great. Well, let's go ahead and start with you just sharing with our audience a little bit about the Helping Our Women organization.
Absolutely. Helping Our Women, I'm fortunate to be in the leadership role for the past 6 years at this organization that's been around for over 30 years now. We're a small nonprofit located in Massachusetts and the rural towns of Cape Cod called the Outer Cape. So that's Provincetown, Massachusetts. A lot of people might have heard of that as a vacation destination, Truro, Wellfleet, and Eastham, Mass. And what we do is serve women living with chronic or serious health conditions in these 4 Outer Cape towns and provide health and wellness programming for all women. And so really the programs that are key and critical are transportation to healthcare appointments. If you live in Provincetown or Truro, you live further from a hospital than anyone else in Massachusetts or as far from a hospital as some of our other neighboring residents in the western part of the state. It's an hour and a half drive without the summer traffic. And when you're not feeling well, that's a long way to go. So our core service is transportation to help improve access to healthcare for women. And then we also provide financial assistance for low-income women to help ease the economic burden of living with a chronic or serious health condition. So those are a couple of our core programs. We provide a lot of personalized support to women when they come to us and have some initial conversations. And then maybe we don't hear from them for a while. We've given them rides, they've gone through some treatment, and they get our newsletter. Maybe they come to a holiday event or a support group or join us for a lecture on some kind of healthcare topic. But it really is the geographic isolation of this rural and coastal area that a lot of people think of as just a vacation destination for the wealthy. And I can tell you that while that may be true, it's also got quite a range of people who live here from all economic means year round. And so that's a little bit about our immediate, who we are today.
Nice. And so let's talk about where partnership comes in with the HOW organization.
Sure thing. It was in the late 80s and early 90s that the women in Provincetown and Truro area, many mostly lesbian women, saw the men who were coming to Provincetown to die from AIDS at the very early part of the AIDS epidemic. And they co-founded the AIDS support group that continues to operate today. And when some other women in town had a friend who had breast cancer, they said, you know, the guys have the AIDS support group. We really need to create something. So there's a real ground from which we've grown that I really wanted to make sure to emphasize, because I think that ground and cultural context is really sets the stage as part of the ethos that has helped this agency that I now run flourish because um, it's in the air. It's in the background and the lives of the people who are in the community, that what we do is care and care for one another, um, and partnering and working together to get things done is really where that the heart of our agency's work and partnering comes from. So that's a little bit that I wanted to make sure to talk about, that bigger context and history that I really am aware of. The women who founded this, and one of our champions, Anne McGuire, who we named our new center in Eastham after, who is an LGBTQ activist and a women's health activist, and that kind of action in the world at the state and national level. And then we benefited from her activism in retirement in this small local community level, as a beacon to show us this is what it's like to operationalize a caring orientation, or that kind of right mindset about that Eisler talks about.
So, in speaking about how you operationalize it, can you talk a little bit about how the leadership does that? Like, talk a little bit about what the implementation actually looks like.
Absolutely. It sounds simple, but I think it's a lot harder than it is. For me in the leadership role, it's about coming out as someone who leads from love. And I took in a leadership program that I'd been in, I took one of these values assessments. So, to understand, yourself as a leader. And there are about 30 of us in the room, the Zoom room during COVID. And I looked at my results, and the computer, after all the answers, said, my primary value for leading is love. And I was a little embarrassed. I was a little bit like, I'm supposed to be, look at me, I'm holding my hands up. I'm supposed to be dominating. I'm supposed to be running the show, command, I'm supposed to be getting stuff done and making stuff happen. Well, that's not my full response to that, because I wouldn't be here talking to you if it was. But there was only one other person in that room of 30 who had that as her top value. And that was huge for me to know I wasn't alone with that. And that was about 4 years ago. And in those 4 years, I've been actively working to use the word love, not all the time, because I really do think when Eisler and Wealth of Nations talks about the caring orientation, I write in my notes, and I look back before I was getting ready for this, mine just says equals love. Not that she also talks about love and the spiritual courage. So I would say that, what does that mean in operations? It means I do sign the monthly newsletter to clients, and my message in it, I write with love. And when we are talking or meeting at a staff meeting at the beginning of every meeting, before we get into what's on your plate this week for work, we get everybody's voice in the room with a check-in that's a personal offer or share something from your life. We're not looking to dig deep. We're looking for a 2-sentence to maximum 2-paragraph reflection from the weekend. How was your weekend? We're creating space. We're creating space and time. So we're making an investment for connection, to build across the team and across some real differences in styles and personalities. So those are some ways with our team that we do that. We do the same thing in our board meetings. We do a check-in, and believe me, one board member's like, can't we do away with this? And I'm like, no, no, this is what keeps us together so that when we have that more challenging issue at hand, we've built that ground and we have that mutual sense of care, not just for the mission or the organization or the business of this nonprofit, but for each other as the team that is, we're the ones stewarding this mission right now. So those are some of my reflections on operationalizing.
Great. And I know you're a nonprofit organization, and so you're needing to apply for grant funding or philanthropic funding. And so, how do you tell that story in a compelling way for your funders?
Yeah. Um, we do it by holding up the loneliness epidemic, and the Surgeon General's report on it. He's been talking about it pre-COVID, and 2023 issued a report that affirmed many of the things that we do or have done, like to invest in building a second center like this. So when I was, we didn't build it, we bought 3 condos and renovated them. When I was talking with the funder about getting a capacity building grant to open this second office, she said, why do you want bricks and mortar? Now we can all be on Zoom. You have your one office in Provincetown. Why would you want bricks and mortar? And I said, I brought up the loneliness epidemic. So really then, and that how do you address the loneliness epidemic and the serious negative health consequences of the loneliness epidemic, which are equivalent to, smoking 15 cigarettes a day is the short phrase that the Surgeon General has used repeatedly. I brought that up, and what comes out in the Surgeon General's report in 2023 is one of the key pillars of addressing the loneliness epidemic is investing in infrastructure that promotes social connection. What we've done with a generous bequest and some low interest COVID loan monies is build out this center so there's a real space that fosters social connection, as well as a space for workshops and other types of gatherings. And in our Provincetown office, I was just last night meeting to look at how do we do the same and make sure that we have not just the open space for social connection to lounge, but the different options for closing a door, and it might be a smaller room because it's a smaller office, and having a quieter conversation and opportunity for connection. So that piece in particular about social connection is, and emphasizing that, and I'm going to be meeting with the board here in the new year. And I've been thinking about our logic model and theory of change. And while we have our core mission to serve women living with chronic or serious health conditions, the idea of creating opportunities for social connection will bolster their health and wellness, as well as the health and wellness of the entire community that engages with us. And so we've also launched a new program, a peer wellness coaching program that will make more intentional our goal of being transformative in women's lives, not simply providing a ride or a stipend.
So, Gwynne, what have been the biggest challenges that you've come across as you've been really operationalizing this ethos of caring and love?
One of the pieces is I've talked about the small ways with the team or the board, just creating connection among ourselves at that level. We all, with some team members, have an ease and a immediate understanding and ability to access empathy and care and demonstrate it. It's not that other members who don't have quite that ease, it just isn't the place they lead from naturally. Doesn't mean it isn't there. And so some of the work has been to understand each other's different work styles, and to not just do one of those type of work style assessments, but to find some different tools, and also not to clobber the team with too many, but to stay curious, and to stay engaged with our team and being reflective about who we are and how we're showing up. But I think the other way is in partnering with other organizations. Have been moving from transactional to transformative in our work with the women we serve, by really enriching and enlivening the connections that exist. So, for instance, housing's an issue across the country. It's here, and the stress on the housing stock here has to do with summer rentals in particular. So we would often say, well, here's the number for the housing agency, but to start to meet with them more regularly on our own, not only over a specific client matter. And what we did is invested a lot of time and energy in launching what is now a federally funded rural health network. And this rural health network that we helped to build came about because we first committed to simply convening the time and the space for anyone interested in the well-being of people living in this area to come. There were challenges. There was a group of executive directors who said to me, "What are you doing?" Actually, one of them, "We have our group. You can come and be in our group." Well, okay, I'll come and be in your group, but I'm still going to go to this because this is open, broad forum for all of us to engage. And I really want to be there. And so there was some resistance to even starting that network idea, and that I wasn't in my lane, where what I knew is how small our agency is. Those partnerships mattered a lot. And I couldn't go out all the time to each different agency or send another one of our small staff members. So if we could convene and find a way to convene regularly and get some funding for someone to coordinate that convening every month, and it would be a cross-agency convening, so we're working together, that would really embolden and allow us to have that caring mindset for the broader community and across other organizations. And that's really important because this can be really lonely work. This can be lonely work. And it can be lonely work as a case manager or a receptionist in an agency. It can definitely be lonely work as a leader in an agency. So to have community and to be in a rural health network convening where people show up, and why are they showing up? The whole purpose is to promote and the care and well-being of the people who live in this geographic region.
You are listening to the Power of Partnership podcast. We hope you are enjoying today's episode and you will consider joining our family of sponsors. Or you can help us attract sponsors by downloading, following, or subscribing to the series and liking and rating each episode you view on YouTube. We also would love to hear from you, including if you have a partnership story that you would like to share. Reach out to us at center@partnershipway.org. And now, back to today's episode. So let's talk now about the journal article that you published earlier this year in the Interdisciplinary Journal of Partnership Systems. It's titled, which I just love, Spiritual Courage and the Power of Partnership, How One Coastal Community is Changing Women's Healthcare. I know you co-authored this article with 3 other women, Jane Sheehan, Janice Murphy, and Eli Ingraham. Can you speak a bit about the article, share kind of a summary of it with our audience, but also speak a little bit about the partnership process of co-writing an article with 3 other women?
Absolutely. Thank you. Well, first of all, it's just a real honor and pleasure for me because I like to write. So I I was on a call with my board chair, Jane Sheehan, And she said, "Oh, I got this deadline I'm going to be working on. I get to get going with some ideas for this article on partnership." I said, "Oh, really? I just did a presentation on partnership for our local philanthropy day on Cape Cod in the region here where we live." She said, "Really?" She said, "Do you want to work with me on it?" And I said, "Yeah, I'd love to. What's it going to be a part of, or what's it for?" And so she sent me the link, and I did a little bit of investigation and wrote back to her and said, "I'm in. I'd be happy to work with you on this. Let's talk." Then when we talked some more about it, she said, "Well, will you take the lead? Will you take the lead in doing the writing?" And she asked me if I would, and I said, "I can take the lead because I want it, and I see it as an opportunity to tell this story about helping our women, and yet what I really want and need is the support in narrowing down or judiciously selecting what parts of Eisler's work enliven and support the story we want to tell about our organization." And she's like, "I can do that. And my colleague and friend, Eli, can do that. And Janice will work with us on edits and part of the story around the history of how." So that's a little bit about how we came together. And really, we wanted to, I've been working to try and tell our story as a health initiative, as a women's health project, as how do I tell it from leading from love? But when I had been talking to Jane about love in looking at and recalling caring and the culture of caring and a caring orientation and the story I've shared about leadership, she said, "I think this is exactly where we should focus and talk about the organization and how we've, like I mentioned earlier, how we came about from a ground and an ethos that is part of something that came before us and before we were created." And even as I say that now, I'm also mindful of the earth and this particular patch of earth that we are so fortunate to live on here in Cape Cod in Massachusetts and on the Outer Cape in particular. So that we really wanted to be sure to not just say we're an agency that, and give some stats about how many rides we gave last year, how many volunteers we had, and here's the work we do, and here's the way we're working with other partners. We wanted to talk about and make sure we somehow recognized that we came from the ground and that ethos was in the culture. We emerged from that in the leadership of the women who formed us and the leadership of the women who have worked in the decades prior to our arrival right now at the agency. And so we talk about some of the history of helping our women and what we actually are up to right here, 2023, 2024. And then we really, I wanted to look at 3 different levels. And I wanted to talk about partnering with the Rural Health Network and how important, I mentioned that already, it has been to our growth and to the ways that in this area we are part of and helping to influence and be influenced by elements of a partnership system that exist alongside elements of a domination system, right? And that's the reality of where we're living. We wanted to hold up that example and then a smaller example of just a one-on-one partnership with another agency. And then the impact, the way we're partnering with the women that we serve to deliver actual services. So through the book, through the book. I guess it felt that way to write it. Um, Through the article, we really are looking at and going back to and highlighting some of Riane's more recent work in 2019 around spiritual courage and trying to pull those threads love, of love in action, of love as action, of love as power, of love as strategic. And even as I say that now, and again, reread it before today's conversation, we could have been even more explicit and dug deeper into simply that facet. But I also wanted to add in an element of work from Rick Maurer and his work about working with resistance, because it helps me. It helps me when I notice resistance in myself. It helps me when I'm partnering with somebody or helping to start this rural health network and hearing from a local executive director, maybe not quite directly, what are you doing? But yeah, you're stepping on toes. And so hearing resistance, seeing resistance as it comes, whether it's across organizations, within our organizations, within myself. We also share some of his work and how when working with a partnership model, when working in partnership with others, when trying to adapt a partnerism approach, it really takes some work, and there's going to be challenges and ups and downs. And here's a tool that, in addition to Eisler's work, that our organization and me in particular, I found to be really helpful. So that's a bit about the article, and it is really, really great that we were able to tell this story in this way. I'm so glad that we got selected.
Yeah, I am too. It's a wonderful article. And for our listeners, I will definitely include a link to that article in the show notes for today. So I know that you've done a beautiful job when sharing different resources throughout our discussion, but I wanted to just give you an opportunity to share any other resources that you would like our audience to know about if they're wanting to increase the overt inclusion of caring and love in their organizations?
So one resource that I'm really new to and excited about is called the Foundation for Social Connection. And they actually have a resource guide that agencies can use to walk you through a multi-step process if you want to take immediate action, or maybe you just want to read about things to do. So the Foundation for Social Connection is an exciting resource. And what they created by traveling the country and doing focus groups with different demographics across the country to bring forth this roadmap they have as an interactive guide for people who want to take some action to respond to the Surgeon General's report and 6 pillars he's presented. How do you take action towards creating a connected community, a socially connected community? The Society for Women's Health Research feel like they do a really good job of creating resources that summarize and present the info from NIH sources in a way, and findings in a way that is accessible to lay people like me. And the last one I would say is Mental Health America has created a really great tool for employers to how can you be a workplace and an employer that is supporting the emotional mental health well-being of your staff. And so again, that connects us back in with the loneliness epidemic. And so Mental Health America, why I like them again, is a lot of excellent resources, a monthly webinar that focuses on specific topics. So if you're a parent of a teen or an infant, or if you're a caregiver, or if you don't have any family, there are a lot of interesting ways that they slice and dice how people in communities are trying to access or might want some support or understanding about resources that are out there. So those 3, that's a good trifecta.
Beautiful.
How's that?
Yeah, beautiful, beautiful. I will also throw in for our listeners, I'll add a link to Power of Partnership podcast episode specifically related to the Interdisciplinary Journal of Partnership Studies, because it really is the first open access journal that has opened the door for this partnership approach to academic articles that really has led quite a movement. So really moving away from domination in terms of how people are able to access journal articles and
Yeah.
how writers are able to access publicizing or getting their articles publicized. So I wonder, Gwynne, before we close our discussion today, I wonder if you have any final thoughts that you'd like to share with our listeners.
Right now, I'm motivated to say be bold. Be bold in how you show up in whatever role you have. Be bold whether you feel the fullness of love or caring in the moment, or you're seeking simply to move along that pathway. Because I think being bold is another way that you can be that and not necessarily be in a domination system type of behavior or default mode, that you can be bold from a caring partnerism mindset and approach that serves as a beacon. And it turns out it serves as a beacon not only for others, but for yourself. And that I do really believe that in the importance of restoring ourselves, that to be in community, to hold up community, and to do the work of weaving connections across community members. We need to find ways to continually restore ourselves. And for some of us, that means going deeper into community. And for others of us, it means let's take some quiet time on a walk someplace. But the idea of being bold in ways that you show up to support connection and community, I think is really what partnership and partnerism is about for me. And I just want to offer that as a final reflection.
Beautiful. Well, I want to thank you again so much, Gwynne, for being here today. It's been really a pleasure.
Yeah, for me too. Thank you. Thanks for the invitation.
Thank you for listening to the Power of Partnership podcast. We're grateful to Rising Appalachia for the use of resilience as our Power of Partnership theme music. If you would like us to feature your partnership story, or if you would like to be a proud sponsor of the Power of Partnership podcast, please contact us at center@partnershipway.org. We hope you enjoyed this episode and will leave us a review on your favorite podcast channel. And don't forget to subscribe to be notified when new episodes are released every other Tuesday. I'm Cherry Jacobs Pruitt. See you next time on the Power of Partnership podcast.
I am resilient. I trust the movement. I negate the chaos. Uplift the negative. I'll show up at the table again and again and again. I'll close my mouth and learn to live.